Hey, what's going on? It's Dr. Toby, physical therapist and health coach. And in today's video, I want to help people who have been in a position where you've gone to the chiropractor, but you still have back pain and you don't know why that is. And I'm going to share with you exactly what you need to do to begin resolving that issue, and also why there probably was that kind of hit or miss situation with the chiropractor. All right, so let's talk about it. By the way, if you are somebody that has had long-term pain or especially long-term back pain, you can go get a free copy of the book From Pain to Empowered that tells you 10 strategies for how to overcome a long-term issue that has caused you pain and what you can do to solve that issue. Go to rehabmobile.com and download that free book, and I'm sure it'll be helpful for you. All right, so let's talk about it. What happens when we go to the chiropractor? We expect our back to be addressed and to be healed by the time we leave, but then we come and find weeks later, days later, we still have that same back pain. What do we do? How do we overcome the scenario? And why is this in the first place? So here it is. So there are a variety of chiropractors, and by no means will I address the vast majority of what chiropractors may do. But for what most people anticipate they're going to receive when they go to the chiropractor, they are going there expecting an adjustment, that the chiropractor is going to correct a misalignment in their spine and things of that nature. And that's kind of been the hallmark of what chiropractors are known for, at least from a layman's perspective, meaning the common person, the average person would expect, well, I'm going to the chiropractor, they're going to fix my back, they're going to crack it, they're going to pop it and fix whatever's out of alignment. Something feels like it's stuck and all of those things, right? And by and large, that's what chiropractors are known for. And let's be real, that's kind of what they do. Chiro means spine, and they specialize in doing things in terms of the spine, and mostly that's going to be hands-on treatment. Now, as time has gone on, chiropractors do other types of interventions in addition to just back cracking that we're normally used to. They use other physical modalities, ice, heat, electrical stimulation, and soft tissue mobilization, which most people would notice or recognize as some type of massage, or using instruments to release tissue injuries like muscle tightness and cramps, things like that. But for the most part, people are recognizing their need to go to the chiropractor because they have stiffness in their back or some type of misalignment or issue in that regards, right? So here's what happens. You go to the chiropractor and they adjust your back, right? Now, the only challenge, or the number one reason why you probably still have pain moving forward, is because although you got the back adjustment, they cracked your back, they did all those things, the only thing is that they didn't address the root of the issue, right? So a lot of times we think that, well, my spine is misaligned, my spine is tweaked, something is stuck and it needs to be freed up and needs to be released, and that will cause me to no longer have pain. But the challenge is that is not the root of the issue. The root of the issue is to come to an understanding as to why your back is in that position. And that's really critical. So just to give you an example, I might have some pain right here on the left side of my back, and this really hurts my back, and it feels like I can't move in this direction. I can't move in the opposite direction. And when I lean toward the direction where the pain is, it causes even more pain, sharp or stiff type of pain. I go to the chiropractor, they lay me on the table, they crack my back and do the adjustment, and it feels like a momentary surge, maybe some minor soreness or achiness, but it feels like something has released, but I still find that I have pain later on. I'm going to show you a couple of exercises that you need to realize that are key to addressing the root of the issue. Now, let's talk about it for a moment. I'm going to use my hands as a demonstration of your spine. If this are your vertebrae that are stacked on top of each other and they move functionally, smoothly when they have an optimal amount of space, but maybe one gets stuck like this. And so now when you move your back, your spine, one of them is kind of stuck. You can fix that adjustment, fix that spinal vertebrae by adjusting it, or what we call a joint mobilization or manipulation. They're essentially manipulating your spine. You can fix it in that fashion, but it doesn't address why your back got in that position in the first place. And that's what's critical. So the number one solution to addressing the long-term back pain for the person who's gone to the chiropractor and didn't get better, or things even got worse, so they still had to have, go back to the chiropractor to get their back fixed routinely. The challenge is that you need corrective exercises to address the postural deficits that are in your back. What do I mean by that? For whatever reason, there may be activities you're doing, positions you're sleeping in, different postures that you have that cause your back to go back into that position, cause your vertebrae in your spine to revert back to that position that requires it to be adjusted. That's the phrase that most people, I think, are commonly aware of. In the technical world, we talk about joint mobilizations and all those kind of things. And there are ways that you can do joint mobilizations or self-adjustments. And for the purpose of this video, I want to achieve helping people to have an understanding of what exercise they need to do to correct the issue. Your core and your abdominal muscles are important to this entire concept because of the fact that realigning and positioning your spine can be done through your own muscle energy, meaning the muscles that you activate in your body can help to not only realign your body's spine, but also to maintain that position. And that's what's really critical and oftentimes missing when it comes to dealing with the chiropractor's adjustments. You have to have a corrective exercise program or plan that corrects the imbalances in your muscle groups and also in your spine, so that the vertebrae that stops moving because it gets stuck, your body's able to reposition and also even prevent it from going back into that stuck position or into that limited position. So here are a couple of things I'm going to show you right now. All right. So number one, I'm going to show you one of the key exercises to helping open up your spine and activating your core muscles to improve stability of your low back. And this is complementary to any mobilization or joint adjustment that you get from a chiropractor or physical therapy. Physical therapists also do adjustments and mobilizations and all those things. But here's what's really important that sets you apart if you want to actually get better in the long term. You want to start off with a basic exercise that is fundamental to a lot of relief for back pain. It's called a posterior pelvic tilt, and I'm going to show you exactly what you have to do. So you lie on your back, and what you're doing is your knees are bent and your back is on the table. Now, we want to activate our core muscles, and we want to open up our spine and provide relief to the low back. So what I'm going to do is every part of my body is now relaxed, and I'm going to push my back into the table. So it's a very light motion, but I feel my core contracting and my back is flattening into the table. Now, people struggle to perform this exercise correctly, and this is so important that it's performed correctly, because if it's not, you will be activating the wrong muscles. And if you activate the wrong muscles, then you're not producing the right outcome or effect. So what I use to help people understand this is arching their back, because arching your back is the opposite of what you're supposed to be doing. When you arch your back, it helps you to realize what position your spine is going in, and then you have better control to push your back down and go in the opposite direction of your spine being arched. So if you have difficulty, arch your back and then push your back down. And you should feel, you don't want your shoulders crunching up. You're not doing anything like that to push your back flat. How you flatten your back is using your lower abdominals, push. And you should see your hips kind of rock back. So as you can see, my hips rock back, and I'm pushing my back into the table. Now, performing this correctly is so important to the entire success of relieving your low back pain. And this is step number one for you to be able to release your low back, but also to stabilize your spine in a very effective and long-term way. And doing this exercise can provide great benefit for you. So how you would go about starting off is doing a 5-second hold and doing 2 sets of 10 of this exercise. But it's critical that you do the exercise correctly and activate the right muscles. And you shouldn't feel like you're stressed or straining. You should feel some tightness in your abdomen, and you should feel your back kind of stretching out, some tension in the low back, especially if you have a tight back. And I'll show you one more exercise that will be helpful for the overcoming the long-term pain that hasn't been able to be fixed with the chiropractor, okay? It's a really simple exercise. What you're gonna do is you are going to just hang down, reach for your toes, 10-second hold, and you would do this 10 times. Now, why this is important is because when you have a joint restriction and the joint is not able to move, it is very likely that muscle tightness will develop, and that also feeds back into more joint stiffness and immobility. So stretching out your low back muscles will release tension in the muscles and also help to provide more mobility to the joint itself. Tight muscles are going to restrict the joint more than it usually should be. And so relieving those muscles through this exercise where you're standing, you can also perform it in sitting. You can sit and just let your body hang down. Really important exercise to consider and to try because that is going to help to produce a long-term benefit and change in terms of your muscle tissues. So I hope this video has been helpful so far. The posterior pelvic tilt can't be underestimated. It's an extremely important exercise because when you've gone to the chiropractor and your back hasn't gotten better, it is a even bigger indication that the underlying cause is not being addressed and that there are posture issues, there are alignment issues that are not just able to be addressed in a singular isolated event, but there needs to be corrective exercises that help restore the posture and the positioning of your spine and of your back to improve those poor alignment and positions of your spine that occur even after you've gone to the chiropractor. So yes, they probably addressed the surface level issue, but addressing the underlying problem is what's really key. Again, I hope this was helpful. And if you feel like you're in a place where you really need more assistance or guidance, you can request a free total body diagnostic on my website at rehabmobile.com, where we'll be able to give you answers to your questions, tell you where the pain is coming from, what's causing it, and what you need to do to solve it for your specific situation. And again, I hope this video was helpful. Leave a comment, like, share, let me know what your thoughts were if you have other questions. And again, if you would benefit from 10 strategies for how to overcome long-term pain, especially in the area of your back, go to Rehab Mobile and download that free book. I know it will be beneficial for you. All right.